You take the prescription, the pain stops. A few months later, the exact same pain returns, so you take the exact same pill. It is exhausting to live in a continuous loop of recurring symptoms. That exhaustion is driving a massive shift in how we approach healthcare today. Patients are actively looking for natural alternatives, largely to escape the compounding toll of pharmaceutical side effects. The frustration stems from the Band-Aid effect. Conventional treatments are excellent at suppressing the immediate distress you feel, but the underlying biological conditions generating those symptoms often remain entirely untouched. This places you in a difficult position. You want true root cause healing and sustainable wellness, but you also recognize the very real danger of ignoring an acute medical crisis by trying to treat it naturally. To navigate this, look at this comparison matrix showing the two paradigms. On the left, allopathy or conventional medicine. On the right, homeopathy. The common narrative frames this as a strict rivalry, but forcing you to choose one as a winner is a flawed approach. Instead of picking a team, we need to map out the specific, situational trade-offs of each approach. The goal is to figure out exactly which tool is required for your specific scenario. Medical survival and bodily optimization do not come from brand loyalty. They come from accurately matching the medical intervention to the exact timeline of your illness. Let's strip away the assumptions and look squarely at the conventional medical paradigm, allopathy. This quadrant chart provides a framework for evaluating medical treatments. The vertical axis measures the speed of immediate symptom relief. The horizontal axis measures long-term systemic safety and the focus on the root cause. Allopathy relies on very specific inputs: targeted synthetic pharmaceuticals, heavy antibiotics, and surgical interventions. The outcome of these inputs is raw power. This system provides rapid symptom suppression, instant pain relief, and life-saving stabilization when the body is in crisis. The required trade-off for that speed is toxicity. These interventions carry a high risk of adverse side effects, and because they target symptoms, they routinely leave the root causes of chronic conditions unresolved. Because of these factors, allopathy plots right here, exceptionally high on immediate relief, but lower on systemic safety and root cause healing. There are undeniable use cases where this profile is non-negotiable. If you experience acute physical trauma, break a bone, need severe pain managed, or contract aggressive infections like pneumonia, you need this system. Allopathy acts as a sledgehammer. It is absolutely essential for smashing through walls and putting out immediate biological fires, but it is the wrong tool for rebuilding the foundation of the house afterward. Now we must shift our entire focus to the alternative paradigm. The holistic, subtle approach of homeopathy. Bringing back our evaluation framework, we can see exactly how homeopathy contrasts with conventional treatments. Homeopathy's inputs are highly individualized. It utilizes in-depth personal consultations to prescribe gentle, non-toxic natural remedies tailored to your specific physical and emotional constitution. The outcome here is biological stimulation. Instead of suppressing a symptom, these remedies prompt the body's inherent healing processes, working toward root cause resolution with zero harmful side effects. The trade-off is time. Systemic healing is exceptionally gradual and requires immense patience. Relying on this slow process during a fast-moving acute medical emergency is highly dangerous. That places homeopathy down here on the matrix. It lacks the speed for immediate crisis management, but it scores incredibly high on long-term systemic safety. The optimal use cases for this approach include chronic diseases like diabetes, thyroid disorders, mental health struggles like anxiety and depression, and long-term immunity boosting. If conventional medicine is a sledgehammer, homeopathy operates as a biological tuner. It is useless in an emergency room, but unmatched for safely optimizing your long-term health. There is an emerging healthcare strategy that refuses to choose just one side of this chart. It's called integrative medicine. The input for this approach requires you to actively combine the acute treatments of conventional medicine with the chronic management protocols of homeopathy. The ideal outcome is comprehensive coverage. You leverage the fast-acting safety net of allopathy when symptoms flare up, while securing the preventative, root-cause wellness of homeopathy in the background. But this dual approach demands a lot from you. It requires significantly higher effort, increased financial cost, and careful coordination between multiple specialists to ensure treatments don't conflict. To see how this resolves your initial dilemma, let's return to the comparison matrix from earlier. We fill the allopathy column with its proven strengths. Emergency care, surgeries, and antibiotics form the absolute foundation of your crisis survival. Then we fill the homeopathy column with chronic prevention, mental health, and immunity. This bridges the gaps left by conventional medicine, creating a complete system of integrative health. True health optimization is an active process of building a layered defense system using all the available tools, rather than restricting yourself to just one philosophy. Theory is helpful, but you have health decisions to make right now. Let's look at exactly how to apply this. This triage system starts with one core question: what is your condition? We look first at the acute pathway. If dealing with an emergency, trauma, or severe infection, speed is the only metric that matters. For sudden pain or fast-moving infections, choose allopathy. In this scenario, enduring potential pharmaceutical side effects is a necessary and acceptable trade to ensure your immediate stabilization. The second pathway addresses long-term issues. If your condition is chronic, related to mental health, or you are focused on prevention, avoiding long-term toxicity is your priority. For managing lifestyle diseases or anxiety safely, you choose homeopathy. The trade-off here is investing months into a gradual healing process. You accept the slower pace to achieve sustainable, side-effect-free living. And if you require stabilization now but want to rebuild your system for the future, you take the middle path. You choose integrative medicine to maximize your overall longevity. Assess the severity and the timeline of your condition. Coordinate with medical professionals on both sides of the aisle. Let your actual physical needs dictate your choices, not ideological loyalty.